Have you ever wondered what are the best vitamins for strong legs? If so, stay tuned because we'll be going over the top 7 vitamins to strengthen your legs today. So let's get into it. Number 7, calcium. Now, did you know that adequate amounts of calcium is important not only for strong bones, but also strong muscles? In fact, about 99% of the body's calcium is stored in the bones and teeth, while the remaining 1% is found in the cells and fluids of the body. Some research has shown that low dietary calcium intake may lead to muscle cramps, so by ensuring you are getting enough calcium in your diet, you could reduce the risk of leg cramps. It's recommended to get 1,000 milligallons per day of calcium. You can get this through food or supplements, and some good sources of calcium include dairy products like milk and yogurt, leafy greens like kale and broccoli, and canned fish with bones such as sardines. However, if you take a supplement, it's recommended to take no more than 2,000 milliliters per day, unless advised otherwise by a medical professional. If you think you might be getting too much calcium, there aren't really any symptoms to watch out for. The body will excrete excess calcium through the urine. But keep in mind that extremely high levels of calcium in the blood could indicate a condition called hypercalcemia, which could lead to nausea, vomiting, constipation, and kidney stones. Therefore, it's important to monitor your blood calcium levels if you have concerns. Number 6, vitamin D. Now, vitamin D is essential for strong bones and teeth because it helps the body absorb calcium. Studies have shown that people who are deficient in vitamin D are at an increased risk of falling, which could lead to fractures, especially in the leg. In fact, one study found that low vitamin D levels were associated with an increased risk of hip fractures among postmenopausal women. Another study found that older men with higher vitamin D levels had greater leg strength and balance. So it's important to make sure you're getting enough vitamin D. Most of the vitamin D in the body is produced when the skin is exposed to sunlight. However, other sources include fatty fish, such as salmon and tuna, as well as fortified foods such as milk and cereal. The recommended daily amount of vitamin D is 600 IU for adults up to 70 years old, and 800 IU for adults over 70 years old. While vitamin D toxicity is rare, it can occur when taking high doses of supplements over a long period of time. Symptoms of vitamin D toxicity include nausea, vomiting, constipation, weakness, and confusion. Number 5, magnesium. Magnesium is an essential mineral that plays a crucial role in many bodily functions, including muscle function. Research has shown that magnesium deficiency can cause muscle cramps, including those in the legs. In fact, studies have found that people with low magnesium levels are at an increased risk of developing leg cramps, especially during exercise. Magnesium is involved in regulating muscle contractions and keeping them under control. When magnesium levels are low, it can disrupt this balance, leading to involuntary muscle contractions, which can result in cramps. In addition, magnesium is important for maintaining normal nerve function. It helps to regulate nerve impulses that control muscle contractions. When magnesium levels are low, it can affect the nerves that control the muscles in the legs, increasing the risk of cramping. Consuming magnesium-rich foods such as nuts, seeds, whole grains, and leafy green vegetables can help prevent leg cramps. Good sources of magnesium include pumpkin seeds, chia seeds, quinoa, and spinach. Additionally, magnesium supplements are available, but it's important not to exceed the recommended dosage as high levels of magnesium can cause diarrhea, nausea, and other digestive issues. Number 4, potassium. Potassium is an essential mineral that plays a vital role in maintaining proper muscle function, including that of the legs. Research has shown that potassium deficiency can lead to muscle weakness and cramping. In fact, studies have found that people with low potassium levels are at an increased risk of developing leg cramps. Potassium helps to maintain the fluid balance inside and outside of muscle cells. When potassium levels are low, it can disrupt this balance, leading to muscle contractions. This is known as hypokalemia. Hypokalemia can cause muscle weakness and cramping in various parts of the body, including the legs. One study published in the Journal of the American College of Nutrition found that participants who consumed a high-potassium diet had a lower risk of developing leg cramps during exercise compared to those on a low-potassium diet. Increasing potassium intake through diet or supplementation can help prevent leg cramps. Some foods that are rich in potassium include bananas, avocados, sweet potatoes, and spinach. Number 3. Vitamin B6. Vitamin B6 is an essential nutrient that plays a crucial role in maintaining healthy nerve function. Research has shown that vitamin B6 deficiency can lead to nerve problems, including those affecting the legs. In fact, studies have found that people with low levels of vitamin B6 are at an increased risk of developing leg cramps and other types of peripheral neuropathy. Vitamin B6 is involved in the production of various neurotransmitters, which are substances that help transmit nerve impulses. When vitamin B6 levels are low, it can disrupt the production of these neurotransmitters, leading to problems with nerve function. This can result in muscle cramps, weakness, and other symptoms. Additionally, vitamin B6 is involved in the synthesis of heme, which is an essential component of red blood cells. When vitamin B6 levels are low, it can lead to anemia, which can cause symptoms such as fatigue, weakness, and shortness of breath. These symptoms can affect the legs and make it difficult to walk or exercise. Consuming foods rich in vitamin B6, such as bananas, potatoes, and chickpeas, can help prevent leg cramps. In addition, vitamin B6 supplements are available. However, it's important not to exceed the recommended dosage, as high levels of vitamin B6 can cause neurological problems. Number 2. Electrolytes. Electrolytes are minerals that carry an electric charge when dissolved in fluids, such as blood. They play several important roles in the body, including maintaining fluid balance, regulating muscle contractions, and supporting nerve function. Calcium, magnesium, and potassium are all electrolytes that are essential for maintaining proper muscle function. As previously mentioned, deficiencies in any of these electrolytes can lead to muscle cramps, weakness, and other issues that can affect the legs. In addition to these minerals, electrolytes also include sodium and chloride. Sodium is an electrolyte that helps regulate fluid balance in the body. Chloride is an electrolyte that helps maintain the acid-base balance in the body. Both sodium and chloride are important for maintaining proper muscle and nerve function. When levels of these electrolytes become imbalanced, it can lead to muscle cramps and other symptoms. Electrolytes can be lost through sweat, urine, and feces, and it's important to replenish them through diet or supplementation to maintain proper balance. Foods that are rich in electrolytes include bananas, oranges, avocados, potatoes, and leafy green vegetables. Number 1. Water. Adequate hydration is essential for maintaining healthy muscles and preventing cramps. When the body becomes dehydrated, it can lead to a number of issues, including muscle weakness and cramping. During dehydration, the body loses water and electrolytes through sweating, urination, and other processes. This can cause the muscles to become less flexible and more prone to cramping. In addition, dehydration can affect blood flow to the muscles, reducing oxygen and nutrient delivery and increasing the risk of cramping. Research has shown that even mild dehydration can impair physical performance and increase the risk of muscle cramps. A study published in the Journal of Strength and Conditioning Research found that dehydration led to a significant increase in the rate of muscle cramps during exercise compared to well-hydrated conditions. Drinking plenty of water throughout the day can help prevent leg cramps. The amount of water needed can vary depending on factors such as climate, activity level, and overall health. However, Most experts recommend that adults drink at least 8 cups of water per day. As we get older, our muscles can become weaker and more prone to cramps. Taking the right vitamins and supplements can help support muscle health and reduce the risk of cramps. However, it's important to consult with a healthcare professional before starting any new supplements, as they can interact with medications or have other side effects. Are you taking any vitamins or supplements for your leg health? Let us know in the comments below. If you found this video helpful, please hit the like button and share it with anyone you feel will benefit. Don't forget to subscribe and hit the notification bell for more health and wellness tips. Thanks for watching. We'll see you next time.